Hi, it's Carmen. Welcome to my channel on living with rheumatoid arthritis. This video today is going to be on a current situation that has just come up for me, and I don't know a lot about it yet. I did a little bit of research yesterday, and so I just wanted to go ahead and share it since it's kind of fresh in my mind. And I have been having some experience of extreme shortness of breath when I have been outside gardening. Like just maybe 10 or 15 minutes of gardening, which, you know, I generally allow myself like a half hour of gardening. I can do that without having too much repercussion. And so I was surprised, like I'd be out for 15 minutes and feel really short of breath and come in the house, and actually stopping wasn't helping it. I would continue to get short of breath, get really tight chest for like a half an hour afterwards, and it's been really scary. It's happened to me 3 times. So I made a doctor appointment with my regular general practitioner and explained it to her, and she says it's definitely inflammation of the lungs and asthma, you know, unspecified. They can do x-rays to figure out exactly what's happening, but generally they start out apparently with just giving you the albuterol inhaler, and you use that when you feel that shortness of breath coming on. And if you start using the inhaler more than 3 times a week, then they want to follow up and be a little more thorough, and then you might be on a maintenance dosage of this inhaler. Now, I think about 5 or 6 years ago, I felt I was having an allergic reaction and being short of breath, and I saw my GP, which was a different doctor at the time, and I did get diagnosed with asthma and allergies all over the place, but I had never had this clenching of the chest feeling, so I knew that it had escalated. The reason I'm sharing this with you is because respiratory lung conditions are the #2 cause of death for people with rheumatoid arthritis. So that makes it fairly common for us, and it can be asymptomatic for many years. You might not notice anything, and unless there's some chest x-ray done for a different reason, they might not notice it. And actually I did recently have chest x-rays for basically shortness of breath related to a heart condition, and but because they weren't specifically looking at the lungs, nothing ever came of that as far as the lungs. I do have some compromised heart situation, which is also a rheumatoid thing. So I just wanted to give you some statistics and be sure that you're aware that rheumatoid is a systemic disease. It doesn't just affect the joints, it also affects body systems. Heart and lung are the 2 areas that rheumatoid will affect with inflammation of the lining of the heart. And then with the lung, like I said, I just began looking into it yesterday to kind of see how that works with rheumatoid. So it's already known to me that rheumatoid, it leads to a high rate of disability and unemployment. Generally within 10 years, very high percentage of RA people will be disabled, federally disabled according to U.S. laws, disability laws. Respiratory causes are a significant contributor to excess mortality in patients with RA. So that means that because it's asymptomatic, you could be having inflammation in the lungs, and studies have shown that once someone goes into the hospital for that with RA, it escalates quite quickly and is the actual cause of death. So that's kind of concerning. Not that we can do much about it except for be aware. If we're exercising a bit and are somewhat active, but we still notice we're getting short of breath when we do anything out of the ordinary, like garden or lifting or, you know, something, go in and get it checked. Go in with your GP and get it checked. I'm going to follow up with my rheumatologist when I see her next month anyway, just to find out if she thinks it's RA related or somehow it's just asthma out of nowhere. But it doesn't, in some ways it doesn't matter that much, because all the medications I'm on to manage my rheumatoid are also managing that condition that's affecting my lungs or my heart. So there's not extra things that they would be doing except for the albuterol, and that is for, you know, so that you can breathe if your lungs do get inflamed. Let's see. Interstitial lung disease is most common. I don't know really quite what that means. There's interstitial lung disease, and then there's chronic obstructive pulmonary disease. Those are two types of inflammation that affect the lungs and affect people with RA. So respiratory complaints. Oh, this is the interesting thing when I was reading these studies, and I've noticed this before, is that sometimes with your general practitioner, everything will be considered part of your RA, and they just want you to see your rheumatologist. If you complain of being short of breath, or you complain of spine pain, or, you know, even your dental health, and yeah, maybe it is part of our RA, but it still needs to be addressed, and someone needs to take responsibility for treating it, either the GP or the rheumatologist, and then we know who we're working with on that specific part of our condition. It's not just RA, it's common with other people with chronic illness, where if you have anything come up, it will just be associated with your chronic illness, and so maybe not identified or looked into as much as it should be. And we can kind of feel like hypochondriacs when we're always bringing something new up to our doctor, but really we can have RA, we can have secondary conditions, we can have conditions that are comorbid, we can have conditions that just any other normal person would have that don't have anything to do with our RA, that need to be addressed and need to be treated. So just to let you know that that's been my experience over the years, that I've become a little more aggressive in saying, no, actually this is kind of an issue for me, and I don't know if it's RA related or not, but I want to have tests done. I want to make sure that I'm taking care of myself. So I encourage you also to be assertive with your doctors as much as you can. So let me just glance at this last study that I looked at to see if I said everything that I thought was interesting on here. Oh, it's just some percentages of what a high percent of rheumatoid people have lung issues. So, you know, it's a little bit scary for me, the lung thing. I don't really want to die of not being able to breathe, but we never get to choose what we're going to die of anyway. So I'm going today to get my little pump, and tomorrow I'm going to be working in the garden, and I can't wait. It's beautiful here in Washington right now this time of year. We're having a beautiful spring, and I'm looking forward to getting my plants planted and having my inhaler in case I, you know, have an attack or whatever. So just sharing with you that, and I'll come back and talk about the heart thing too, because I have some experience with that, and I'll do a video on that. Thanks for tuning in. Hope to see you again. Take care. Until then, bye.